Are there any questions in the chat? Did I miss anything? None so far? Okay, so we're back. The recording is on, and I'm sorry about the background noise, but let's skip to it. I think I'm quite loud and clear. If you do not listen to the background noise, I will make sure.
This can cancel background noise.
This can cancel too. I will try and cancel my background noise. Let's see. I was trying to listen to people around me. Okay. That's brilliant, Iftikhar. Thank you so much for your feedback. Can you move on to the next slide, please? Okay. So, can you see well? Is it clear? Yes. Okay, fine. So, all this. Now, I also found one of the CVs that I read through in last few weeks. I'm just going to put everything out which I thought was not right on the CVs or resumes that I see of doctors. I know as a medical professional, especially coming from India and Pakistan and Bangladesh and Sri Lanka, our countries, they never emphasize on how to present ourselves. They always make us feel like we're not good enough. We're always very good enough. First of all, be sure you're good enough. You're better. You are rather overqualified for the job you're applying for. Unless you do not have confidence in yourself, you're not going to sell yourself. So always feel confident, first of all. And start from the recent experience, whatever it was. You were teaching somewhere, you were writing for somebody, you were on maternity leave like I was. So always start from the recent things. And then move on forward. You do not, do not leave anything out of your journey. I read through when I was doing clinical fellows interviews last year with North Manchester. We found one of the CVs, and he said he was a mechanic for a while. Now, you must know that a lot of people do different jobs while they are doing part-time jobs while they're studying. A lot of people in UK use medical related jobs, but sometimes they do other jobs. Like I did a lot of teaching. When I was a student, I wrote for somebody. I did a lot of freelance work. I've put that part in my CV because that's who I am. I can do other stuff other than what is, juggling on the emergency shop floor. So no work is less work. Always remember that. If you have done 10 days of volunteer work, if you've done 1 day of camping as a volunteer and you went all the way to Sawat, maybe you went all the way to someplace else and you did a camp and you were like there for them, that matters because that's who you are. You volunteer. Why you leave that out? Because a lot of people think that volunteer work should not come on the CV. No, it should. You volunteered. It should be part of. It should represent you. It should amplify who you are. If you have gaps, now that is a difficult thing. The gaps are really important to be filled. GMC or any other international bodies do not accept gaps. And if I'm reading through a resume, I know GMC will want you to have a 2 years continuous job. But for example, if somebody did his or her graduation in 2010 and they did their whatever fellowship they had, residency, house job, in their country for getting their, a license to practice, and they got married away or they got into something else or whatever happened. They did not work for 3 years and then they started work again for 2 years continuous and they have now got GMC. Now when they come to me, I want to know what they did in those years. Were they totally away from medicine? Be clear. one of the people on the clinical fellows last year, she said she went on backpacking and went through the world. She was backpacking 8 months. She was not a doctor. She was an explorer, which is fine, which is absolutely fine. She enjoyed her life. She saw things around. As a doctor, it's very difficult to travel, and especially if you're working. She says, once I was done with my studies, I didn't wanted to go into foundation years without, seeing the world. So I saw the world. I backpacked around the world for 8 months, and that is completely, absolutely acceptable, right? So write that down. If you have a gap of 1 year because you had a baby and you were looking after that baby is a new life that you brought into the world. That is important to you, and that is important to your family, and that is absolutely right. It is completely acceptable. Why we cannot say, especially there are a lot of women on the call as well, so I would go ahead and say why we as a woman cannot take our responsibilities and be proud of it. So don't be shy of putting anything in there. Don't put gaps in there. The CV should not look like it doesn't have, it doesn't completely, tells the whole story. What happened in between that time? Don't leave it out. We can go to the next slide. Now, when I've talked about everything else except clinical experience. When I say clinical experience, no, so gaps will look negative if you put them as gaps. For example, you put down, I've done this and this from 2010 to 12, and then there's nothing between 2012 to 2015, and then you say I've done 2015. Then if somebody comes to you and first, second or third, whichever, if this is brought up in your CV, what were you doing between those years, it means that gap is given a negative point of view to them. So don't leave a gap. Put something in there. I was on a study leave, I was doing my education, I was doing another degree, whatever. Just put something in there. And you were not doing something, well, that's bad then. But even if you were taking care of your mother, if your mother was unwell, your brother was unwell, if something happened in your family, your dad's business was falling apart, you wanted to support your dad in the business, everything matters. See, you were not... yes, one thing that does not matter and does not make sense, I've not done it myself ever, people take gaps to study for professional exams. That is not acceptable, and don't put that in CV. Put something else, put something that matters, that substantiates, because I think we are adults, we shouldn't take time off for just professional exams or just to appear in exams. We did not do that when we were studying as a student. We had prep leaves of 4 weeks, and we went into exams and we cleared them. So taking a gap of 6 months or a year to just for preparing an exam and putting that in CV will not come good. So something that matters to you, something that is life-changing, something that is a life experience, something that is an added experience to your life, whether it was medical or non-medical, does not matter. Just don't leave a gap in the CV. It looks really bad. 2 months are fine. Anything more than 2 months will look bad. Now, clinical experience is very important. A lot of people put down as house officer for themselves. Let me have a second. Now, house officer or house job is not something that is now a common term in United Kingdom or United States. They used to have house surgeons and house residents. Then their fellowship program was very different. They used to live in the hospital for 6 months, so that's why they used to call them a house surgeon or a house physician. You know what I mean? This is how the term developed. A house physician used to live in the ward for a whole month. Now they don't use this term anymore, and because they don't use it, only very old people would able to understand what a house job is, and our house job is very different. So it's actually a foundation program that happens in our country, and it's different. So don't just put up a house job from this time to this time and assume other person is going to understand what you're saying. It's very different in every country. So when you write your clinical experience, I know you would say that your role was as house officer, your title was house officer, but what does that title mean? So very concisely, my job was to clerk patient or history taking, or was it more? Is something wrong? No, my presentation has gone down.
Can't you see it?
Yes, can we put just back onto slideshow again?
Yeah.
Thank you. So you have to tell them what you were doing. Like were you just taking, for example, if somebody works in eye for a house job or a house physician in the Department of Ophthalmology, I bet that they're not going to let you touch the eye during surgery, will you? No. So your job would be taking history taking, clerking, and seeing patients in the outpatient department, or seeing patient post-operatively, or for example, like I have put my experience in that I worked with a surgeon XYZ, and I assisted him in different surgeries like carotid endarterectomies, and I was also responsible for their post-op care. Bisma, you have a question?
Yes, can you hear me?
Yes.
I just wanted to ask, like, we know that we cannot use the term house officer, and now they're even moving away from using the term senior house officer, which was quite commonly being used in UK and is still used. But they're trying to get away from that term. But someone who's just joining in, we know we role as house officer. Is it worth mentioning the CV that I've worked as an F1 equivalent? Because I've seen some people who say, oh, yes, I worked as an F1 equivalent back in my home country. So is that the right way to put it? Or do you put it as I've done a 1 year of internship?
Okay. First of all, house job is not internship. Never put house job as internship. Internship is something that you do. It may or may not be paid. Most of the time, internships are not paid, and sometimes you pay for the internships. For example, if you go and do internship in King's, you pay for it. So most of the time, internships are not jobs. So never say house job was internship. One. Number two, I'm talking about preparing your resume for international purposes, right? So you can send that resume to USA, to Saudi Arabia, so to United States, anywhere, in Canada. So if you say foundation year, again, it would be something that's not a global thing. If you are just making a CV for United States Kingdom, you can say yes, my house job or a house officer is a role equivalent to foundation years, but you can leave that out for the interview. You can just state what your role was, because it's not about whether it was a foundation year or not. It's about what your role was. What did you do? Now, foundation year 1 in UK will not do as many things as a house physician in Pakistan. Do you understand what I'm saying, Bisma? Where I'm getting from? Because a house surgeon in Pakistan would do appendectomies. A house surgeon in Pakistan would do independent triage in A&E, would do laceration suturing, a lot of things, which foundation year 1 will not do in UK. So when you say it is equivalent to foundation year 1, you actually decrease the amount of things you have done, or you do not sell yourself enough. I've seen a lot of CVs where they say that their house job was equivalent to foundation years, but when you say foundation year, you're not actually explaining what you were doing. So instead of saying that they are equivalent to foundation years, I would say put down what you have done. I've done appendectomies, I've done independent triaging in A&E, I've assisted surgeries as second hand or first hand, whichever. Iftikhar, you have your hand up.
So before, thank you for your answers. would just point out, because I've seen that coming across quite a few times, or working in HS for the last 3 years, I've seen a lot of people keep on saying these terms, and this is being used even when you interact with your colleagues here in UK, because they don't get what you've actually done. So you just start using it, and somehow that thing just gets translated onto the CV as well. And so thank you for your explanation. I think it would certainly, hopefully it would help a few people and just avoid those getting those terms, because it's just a matter of explanation. Thank you.
Yeah.
The next question.
Iftihar. Okay, so first of all, Iftihar, I would again say that don't think that you are not worth it. You have worked a lot, and you definitely deserve it. You definitely are more worth than anything else. First of all, this. Second, I agree. When I come to UK, I'm not saying that I've applied as a job as a surgeon, but I worked as a surgeon for 5 years in Pakistan, and I was very good at it. So, reading through my experience, I've assisted as a first assistant in a liver transplant, and I've done a lot of surgeries, including plastic surgery and total knee replacements. So, looking through my resume, the interview did ask that, don't you miss surgery? I was like, yeah, I do miss surgery, but it's the thrill of A&E that calls me. And then when I came to my first job in Blackpool, they were like, you have all the qualifications, we want you to start as registrar full time. I said no, I refused. And I said, well, the reason to refuse is, A, this is a new country, B, I don't know your stuff. I don't know how things are done in your country. I need to learn them first. I even shadowed with somebody for 3 weeks, and this is when I started a job as a registrar. I came to UK as a registrar, and I was working as a registrar, a senior registrar actually in Pakistan when I came to UK. But I said no, I want to know your system first. I need to know a lot of things before I start working. There's a lot of difference between how the things are done back home and how the things are done here. So you can always start with, yes, I have done all of this, but I would like to see them being done in your setup first, then to go ahead and do myself. They will never think you are overqualified. They will always think that you are somebody who's keen to do stuff, and if he was or she was given the opportunity to do it, you did it. So that's, if you've done it, just write it down. It's nothing. Don't say that, for example, I've done 110 appendectomies. I did a count, and there was a thing in our, when I was doing training, that who will do 100 first. So I did 100, and We had a party about it. You know how surgical training goes in Pakistan. Um, but I've not put that in my CV because that does not matter. That number does not matter. That was something a bet in my department, and we did it. So I just put down that I've done appendectomies. But don't sell yourself short. And then again, like you're saying, Iftihar, what I'm trying to get from you is don't oversell yourself. Just be something that you think you are. Write on the paper what you are, what you feel yourself comfortable. Like I did assess a liver transplant, but can I do liver transplant? No, I cannot. I did assess a lot of craniotomies. Can I do a burhole? Yes, I can. But can I do a craniotomy? No, I cannot. So don't write something that you cannot do. When you're writing a sentence, make sure you know what you're writing and you can do it. Don't write anything yet that you cannot do. Can I do chest strains? Yes, I can do. I can do independent chest strains. But still, I had to come here, do my chest strain training, into different protocols, and then I got my license, and now I can do chest strain. Can I do ultrasound? Yes, I can. I did ultrasound. I actually have ultrasound diploma from Saudi Arabia, but still I had to do my POCUS licensing, the POCUS diploma from here. So everything that you put on the CV will not, you're not be going to be asked to do it straight away. They will ask you to probably make your goal, and you can say this in your interview, that my target is to achieve these diplomas and to start doing these things independently when I join your trust. So when you put these things in, it means that you are going to learn to do these things, and this is something that you know, which means that the job that you did, you know that job. It's not something, they're not going to think that you were just somebody who was clerking notes there. Also, be prepared. If you have put all these things in your CV, your questions will start from the next level. You know where I'm getting from? If you have made your CV at a registrar level, your questions start from that level. They're not going to ask you foundation year questions. Then they're going to ask you questions that are on your level. So if you think you won't be able to do good in your interview at that level, then don't put them in. So, like I said on my first slide, write on the paper what you think you are. You are a registrar in your heart, write that on the paper. You don't feel like it, don't write it. Okay? Next thing, and which is very important, that, no, we're on the same slide. Which is very important, is which hospital you worked in. Okay, so if you did all the history taking and clerking in, for example, I'm giving example of UK so everybody understands what I mean. If you did your foundation year in Hull or Blackpool, and you did your foundation year in St. Thomas in London, when you put that down, everybody knows it's different, right? So that is what happens in the UK, because they know the hospital setups in the UK. But when you say, for example, I worked my house of physician year in 6 months in Holy Family. Now when I write down for Holy Family Hospital, nobody would understand in the United Kingdom what does that mean. When, like I said, Holy Family Hospital is a 1,000-bedded hospital, which is a huge hospital, and sees around 1,000 emergencies every day. So you start with this, that gives them an idea what was your workload like, right? So it is different for everybody. For example, somebody worked in Lahore, or somebody worked in Dubai, or for example, I worked in Saudi Arabia for a year in a clinic where I used to see 3 emergencies a day. So it's different for everywhere, and you have to put this stuff down because you want the person to know where you worked. It must be famous in your country. It might be famous in that region, but that doesn't mean it is famous around the world. Okay? Even if you work in UK and you are going back home or going back to Pakistan, Blackpool Teaching Hospital doesn't mean anything to them, or North Manchester General Hospital doesn't mean anything to them. They need to know, is this a district level hospital, or a tehsil level hospital, or is it a teaching hospital? What kind of emergency they used to see? Every hospital is different from the other hospital, so you have to sell your hospital as well. You know me. If anything is unclear, please ask questions. I feel like I'm talking to myself. Can you go to the next slide, please? Yeah, we have a question.
Yes, there was a hand raised from Fatima, I think, earlier. It was Fatima, and raised just after Iftihar. So, Fatima, if you can ask your question, please. Fatima still with us? Yes.
No. So Fatima, the thing is, I was airway trained even in Pakistan. I still am not allowed to do airway here. Now I am, but I had to do my airway training again. So these things, the specific things like airway training, like ALS, even you were ALS certified back home, you had to do ALS again. So these things you have to do again in this country anyway. And F1s even in UK, if they do their airway training, they can do airways. Now everything is different in different countries. So when we say that as a house surgeon in Pakistan, not as a house surgeon. I didn't do appendectomies as a house surgeon. I did I think 10 maybe, or those were all assisted by a senior. So I don't think you can put them as you have done those appendectomies. I was a surgeon for 5 years, so I did appendectomies during that time. I'm not saying that if your department was overzealous and they let you do appendectomies as a house surgeon, I am amazed. But still, you can put them down only if you were able to do them independently, and which I think you were not. So I don't think any house surgeon in Pakistan was able to do independent appendectomies. If you were, and if you are applying for a surgical post, do put that in. It means that you were keen enough to learn to do it. So you won't be able to do it here, or you won't be allowed to do it here. So the thing is, anything is unsafe when the person who's doing does not know how to do it, or is not taking proper precautions. It does not depend on the level, it depends on what is their knowledge. Okay, so if you were doing appendectomies and you were knowledgeable enough, then it is totally safe. And putting it that down because you've done it doesn't mean that it's not acceptable, and it's not being safe and safe on the CV. CV means that the thing that you have done. So don't think about those things. If you will start thinking, I can cry on the CPRs I have seen in government hospitals in Pakistan. I'm not joking. I can really literally cry on them, because even in Pakistan, I was one of the BLS trainees for 1122, that is the emergency services in Pakistan, and I used to bang my head on the walls because nobody did the right CPR. But does that mean that you are going to say that I don't know CPR? You know CPR, but you have not been doing it right. because you were not taught the right way. So the thing is, you have to say that you have done this, but at the same time you have to say that you are interested or you want to learn more. You are here. Why you're here? Why? I think I have missed that slide. That was the ambition. Why you're coming to all the way to United Kingdom? Just for money? No. You want to learn more. You want to learn more things. You want to be a safe doctor. You want to learn proper protocols. And when you start working there, you would emphasize on learning these things before you start actually treating patients. Fatima, if my answer is not clear, you can go ahead and ask me again. I want to be clear before we move forward. Is that okay, Fatima? You're welcome. So it is interesting that we think that everything that we have done is not per level of United Kingdom, so we should not put that in. No, but you have done it. You know what I mean? If you have done it, just put that in your CV. And this slide, like it says, that never forget your teachings. You've done some presentations, you've done some teaching, you've done some junior level coaching, you've done some demonstrations, and even on ward rounds when we are house surgeons, we are given a badge of a final year student to teach them methods or to teach them when you grow further, like I keep on omitting a lot of things when I go on add on something else, because now I did my graduation in 2009, so you can see it's like a lot of years, so I cannot keep everything on it. It's still 5 pages long. I keep reshuffling things and taking things out and keeping few things that matter a lot, but do not leave a lot of things out. If your post-grad time is 3 years, then you need every one of those. Like you did teaching for final year, you did methods with final year, you did all those little things that you don't think of, that they don't matter, but they do matter when you present yourself that you are somebody who your senior registrar or your professor or your postgraduate trainee who was giving you time dependent on to give that education to the juniors. So that shows that you are a keen learner and you like teaching, because teaching is a very important part of clinical knowledge, because anybody who can teach can learn, because learning comes from teaching. Always know that a good teacher is first a good learner. So do not think of these things as little or they don't matter. They do matter. Also, I've seen a lot of CVs. People have tried to cram everything on one paper. No, your CV, your resume is a summary of your life. It cannot come on one paper. That is for a cover letter. That comes on one paper. It should be of 1,000 words. It should not be more than that, and it should be only when you are asked for it. You don't have to provide cover letters for every job. If they say that send your job with a cover letter in, then you send your job with a cover letter in. You don't have to do it all the time. Also, don't put your references straight away. A lot of CVs I've seen, they put their references. You don't want your referees to get bombarded with emails and telephones and calls from people every time you send your CV in. Only give your references once they're asked for. They'll call for your interview and then they'll decide they want to hire you or not, and then they can go ahead and ask for references. Is that clear? Is anybody got a question? Is there a question in the lobby?
Fatma is just thanking you. He's saying that was really helpful.
I'm sorry,
You're welcome.
We're having a quick water break. I think we've got a few people who joined in us a bit late. So guys, whoever's joined now, I think we've covered a few bits, but if there are any questions or if you guys got anything on your mind which you think you want to be covered in today's session, please just let us know. So if you've already covered it, you might think of just repeating it for yourself, so that just we know that how far you or what you want us to help you realize. Over to you, Amber, now.
Okay, let's go to the next slide. Okay, now when I started making this resume presentation, I skimmed through a lot of things on the internet as well, and you guys can go and see there are different types of resumes. There's a lot of types of CVs that you can make. I prefer a hybrid and a chronological form. Hybrid is something that is a combination of your clinical experience, your educational experience, and it should be always starting from the latest towards the the oldest. Okay, now the thing is, like I said, I graduated in 2009. Now for me, my high school is old news, right? My high school was in 2004. I'm not going to put my high school on my CV. Does it make sense for you? But somebody who did their high school just 5 years ago and they have graduated last year, it matters to them. But to me, it does not. And because it does not matter to me anymore, if I read somebody's resume, I'm not interested in their high school anymore. And I'm saying that I am the graduate in 2009. The interview panel that I was sitting on last year, I was the second youngest. There was one person who was younger than me, and I was the second youngest person, and she graduated in 2013. I graduated in 2009. Everybody else graduated before I was born. So I'm coming to the point that we think that we did great in high school, and yes, we did, and that led us to med school. And if you're a doctor, it means you did great in high school. So you don't have to put that on your resume. Does it make sense? I've seen a lot of resumes detailing up to their secondary school. That's how it goes in Pakistan and India, that A levels and O levels in UK. Nobody wants to know, because if you didn't do well in A levels and O levels, you're not going to yes, that's what I'm saying. Do not mention high school in the CV. That's what I'm saying. A lot of people have mentioned their high schools in CV. To me, you went to a med school, right? So it means you did well in your high school. You don't have to put it on your CV. It does not matter to me or anybody at all. So, and the grades. We as medicine, when I skim through CVs and I'm looking for a person to hire, I see, well, they're doctors, and I just go and see where they did their MBBS from, like where they did their medical degree from. Was it MD, was it MBBS, or anything else? Where they did it from, which year they did it from. I'm not interested in grades, because if they're passed and they have got a working license to practice, it means they have good grades. It doesn't matter how much marks they got and which grades they got, and were they successful or not, and they were, some subjects they got distinctions. I don't care. Yes, only thing if you want to mention on their CV, which is again is more important for recent graduates. You feel importance when you're recently graduated and you recently got a gold medal. After some time, the shine of the gold tarnishes. A lot of people will understand this, that it does not matter anymore. When you are on clinical shop floor and seeing a patient, to that patient, it does not matter that you were a gold medalist or you were a first position holder or whatever. That does not matter to that patient, will it? So when somebody is going to hire you, it does not matter to them as well, that did you get a gold medal, or you scored high, or you were on top of your class. No, it does not matter. Will you do good in an interview? Does your CV sell enough? Do you have good enough clinic experience to work in that role? That's what matters. So, putting all these details on your CV are not really helpful. Uh, so, the things that you need to put on your CV is that you have that degree. Even if you have a degree that is not recognized in Pakistan, in UK. Yes, you have a question.
I heard this. I think someone just commented, Fatma, he just mentioned that distinctions do hold points when you're applying for training, and it definitely matters. So I do get this point. I think she's talking about mid-school distinctions. So just to clarify that point.
That's what I'm saying. So if you're a recent graduate and you're applying for a training, you get score points. They have their different forms, and you put your distinctions and your grades in those forms. You don't have to put distinctions on your CV, and only distinctions that matter.
I think the med school, there's a difference because, just for my clarification, you're talking about here between high school and med school.
Med school. I'm saying only the distinction or the gold medal that matters is the med school,
yeah, I think
not
that's
high
what we are,
school.
Fatma, I think
No.
this is, we do agree with the point that distinctions in your med school do matter. So I think the previous point was just regarding the high school, which was it. But thanks for your input. Thanks for clarifying.
I'm going to go back to Fatma's question. Distinction or gold medal will matter only if you're applying for a training post. And again, there is a whole system of applying training post, and there's a form you fill in, you put your distinctions in, you put your gold medals in. When you're applying for jobs or roles, they usually don't go and see your distinctions, and the gold medals, they don't matter to somebody who is interviewing you, because that it gets a bit of bias, because the person that you're interviewing, you get scoring on when you're applying for trainings, right? If you're getting this, you get points for.
Can I just add something? I think there's some mention that there are no points, so distinction does score points. Yeah, just want to clarify, because I applied last year for MT training, so distinctions in your mid school, they do score you points when you're applying for your training. So that is, and I think schools it has got a different scoring system. I'm sure we can address it at some point. But if you're in top 10 of your school, of your med school, and you've got evidence of that, it scores you maximum. And a distinction in one subject scores you 2 to 4 points. I think it's different for every training, but it does score you.
People waiting in the lobby. Yes, like Usman and Fatima are having a conversation in the conversation blog. Yes, distinctions only matter if you're specifically applying for a training job, and training jobs in the UK go through, a set of tests and all that kind of stuff. So you have score for your med school grades, you have score for how long you have graduated. So if you are old graduate, you gets you less score and all that kind of stuff. And then you have exams, and then you have scoring for distinctions. So again, I'm saying those are different things. That's not what is going to come on your resume. Your resume is a different thing. Like Iftikhar said, it does not make sense. For example, if I'm hiring somebody for a clinical fellow, I don't care if they got a distinction in surgery, because I'm hiring them for A&E. Does that make sense? So if even if they got a distinction in medicine, will they be able to apply that knowledge on the shop floor? So that is what they're going to sell to me in the interview. So all those distinctions, and especially if somebody's got a distinction for, say, in pathology, does it matter to us anymore? No. So we will do a separate session on training, how to apply for a training job, or what is required for a training job, or in a different setup. But on your resume, on your CV, when you're applying for a trust grade job or a clinical fellow job or a registrar job, it does not actually matter that you had a distinction. What will matter is that what you awarded something. Yes, if you were awarded best clinician of the year for some year, that matters. If you're awarded a best surgeon of the year for some year in a hospital, that matters. So there's a difference. Now your education is finished, and your clinical experience has begun, and when you apply for a job, you actually need to sell your clinical experience, not the knowledge of your med school. And I don't think anybody is going to disagree on me when I say that what you were taught in med school was very different from what you actually go and apply in the clinical field. So any distinction that you gain through filling on those forms and papers in your work that you did in med school actually does not really matter in clinical life. In clinical life, it matters that how quickly you can respond, and how good are your reflexes, and how good are you retaining information, and what good team player you are. So that matters. So if you got a distinction while working in a department and you were awarded as the best clinician for that year, I was in Blackpool, so that matters. That certificate matters, and always try that person to write you a recommendation or a certificate, and that matters. That you were awarded a distinction in a clinical setup rather than an education. They're two different setups, right? So putting your grades in, or putting your final year marks or your final year distinctions, they may score when you're going for training, and that is a totally different pathway from what we are talking today. But it does not actually matter when you are in a clinical setup. Is that clear, everybody? Especially Usman and Fatima. Oh, have you guys left? You're welcome. And I'm just going to... Yes. Okay. Can we move on to the next slide? Let's go to questions again. And everybody who's joined in, I'm just going to summarize. A lot of people joined quite late. So we talked about resume. This whole thing is recorded. You can go through it. The presentation has nothing on it. Actually, I was told to make something for the screen. So that's it. I talked a lot. I can talk still a lot. And we are open for questions. So what I want you to take home from this presentation is A, you're worthy, and put that on the paper. You mean something, and that should come up from reading your CV. You should know who you are. 2, you are not sure about something, don't put that on your CV. But if you have done something and you're sure about it, just write it down. 3, very important, no gaps. Gaps are not acceptable. Gaps give a very bad impression. Make something up. I usually don't say this, but if you don't have anything, just make something up and put that on CV. Don't put anything of more than 2 months gap. That is not a nice way to come up. And if you have a lot of gaps, then you should understand that you would be coming down on the job interview list, or you would not be shortlisted. Third, I need you to take that your experience matters, all of it, but your education matters as well. And teaching. If you've done a presentation, put that on, and you don't have to put everything on it. I've done a presentation for vascular emergencies in year this and in this setup. That's it. You don't have to just name of the presentation, which date it was presented, and that's it. You don't have to put anything else for that presentation. It would just mean that you were keen to learn and you were keen to give it on. Any questions? I'm open for the phone. I'll go for the chat. If you cannot speak up, you can write it down. A lot of people are actually from UK who are on this today program, and I was thinking a lot of people will join from Pakistan.
So we've had quite a few registrations. It's a weekend, so it's understandable that people might just be enjoying the Saturday off at home. And in UK, I think the weather's even better today, so they might be more interested. But that's fine. We'll have the recording. We'll have more sessions coming up. In the meantime, the people, I think we can take advantage of this, that we've got not many people around. I think we can have a more of a conversation, an open forum where everyone can have discussions. I think we did a bit of interviews to begin with, and we had some junior doctors with us. There's someone who mentioned was working as a registrar. So guys, please feel free, maybe just introduce yourselves now. And then we've got Usman Bhai as well. I believe he's working as a pediatric consultant in London. So we've got people from all grades here, so please feel free. You can have an open forum discussions, not in particular with not even CV building, anything, any queries, any good points that you might have which can benefit, even me or fellow colleagues in Britec. Guys, any suggestions for improving Britec, any suggestions for future sessions? Anyone? We've got a hand raise from Seb. What's that?
Seb, we cannot hear you well. Yes. Good morning. Seth, you're welcome. Seth, I'm going to do a session with Bisma just on trust grade jobs and what do they mean. When we apply for trust grade job, we think we are going to apply for the role of, for example, we are applying a trust grade job in orthopedics or surgery. You think you're going to be working as a surgeon or as an orthopedic, while in reality, trust grade job means that you are going to be a clerk. I'm sorry to say this, and maybe Usman can emphasize on it as well. So trust grade job means somebody who's going to be a buffer for the trainee to work towards his or her training. So when you apply for trust grade job, you are there to help the trainee get through their trainings. So you would be doing your clerking, you would be taking histories, you would be taking care of post-operative patients, while the trainee, on the other hand, gets through the all the trainings that are required to be a surgeon. So unfortunately, I don't think you're going to get a lot of time to go to theatres. Unless you're on call and there are some emergency surgeries and you have to scrub in for them. Secondly, you are only second month here, so you have to prove yourself. So try and do the trainings that are available. So if you have teaching sessions, attend those sessions and show your interest towards them and present in them. So try to be part of the training that is already happening in your department. Take up courses. There are a lot of training courses, like there are trauma courses, there's ATLS, a lot of things related to surgery that is happening elsewhere in the UK. Book yourself in and your trust will support. They are meant to support you through your portfolio building, so they will pay you up for it. So if you do ATLS and you come back and submit your fee and your certificate that you did at ATLS, they're going to reimburse that fee. If they don't, you can take it back from tax. We're going to talk about a session about this money things, because these are very important, how to manage money in UK. And so you have to prove yourself that you want to be part of training, and then you start getting stuff. And even taking surgery is really, really important in taking histories in surgery. We back home, I didn't get Seth, where are you from? Sorry, pardon me. Oh yeah, so I've worked in Middle East as well, so I'm quite mindful that a surgeon means that somebody who stays in theatres or goes to A&E to cherry pick their patients who need to go to theatre. So it's quite different here. History taking is really important. Making a decision on patient and taking care of those patients is really important. And from there, you have to add this. If you go to the curriculum on the website of Royal Colleges of Surgeons and Physicians, Royal College of Surgeons, sorry, and you take out the curriculum and start working towards it. Then you take the membership and you start making portfolio on it. And Bismillah, you want to add something to it?
Yes, thank you. So I'd just like to add to Safi's point is that because I worked in a clinical fellow job for quite some time, although from experience of any surgical specialities, and I do understand that's more hands-on, what I would suggest is we do agree there's an aspect of our job which is service provision, and then we think like, oh, we're not getting much hands-on. But anyway, because you're new to NHS, once you got to know to the system, I think the way around is when you speak to your supervisor, because every trainee does have a supervisor, sorry, not a trainee, anyone who's even working in a trusted job does have an educational and a clinical supervisor. So you're meant to have that. I'm sure you've got that person with you. So if you go to them, you address, the importance is you just meet your supervisor frequently, the same as trainees do. And your supervisor, I'm sure once he gets to know that you're interested in it and this is what you want, he would organize something for you, get part of your, maybe get you into your rota so that you can have time for that. So you might need to put in a bit of more extra effort, just speaking to your supervisor, shuffling your shifts around, speaking to your colleagues. For example, if you're covering the wards and if there's not much to do, then you can just they can just cross cover you if there's not much to do. There's the foundation doctors and all, and you can go down to theatres. So that's what you can do by yourself. And the main thing is if you just speak to your supervisor, make him aware this is what you're interested in, this is what you're looking for, and this is something you're not getting enough. This is not guaranteed always. Like, even with the trainees sometimes, because especially with COVID and all, when we do suffer on short staffing and all those issues, they do issues, but the main thing is you just address the appropriate people, the consultant on call, whoever you've got on surgery, and the main person is your supervisor. If you go to him, you see him frequently, he would arrange something for you to help you out so that you get, if not very frequent, some frequent sessions so that you can spend time in theatres and get your make sure that he's aware that this is something you need and this is what your plan is. You want to go for surgical training, you need this, and I'm sure they'll help you along with it.
So the thing is, the point is, and I think Usman will agree with me because he's the consultant on the call, so I'm just picking his name again and again, and I'll keep doing that. Is that to making them, everybody aware that you are interested and you want to take part, and that you can show by going to the meetings, attending all educational meetings, arranging. You're 2 months into your service job, so you need to make sure that you set up a meeting with your supervisor as soon as possible and set your goals. When you go to the meeting, you write down your goals. I want to be in the training job by the end of this year. I want to start training. I want to achieve this level. This was my level when I was in Iraq, and I want to achieve this level. So when you go to that means Edinburgh or England, whichever you want to go, and set up your curriculum goals, and you do something. And I'm trying to say is that when you go to that meeting, you present yourself that you are working towards it. You have booked yourself for ATLS. I know there's no booking available for next 2 years, so try and find one. Or if you don't get any booking, ask your supervisor to help find you one, because a lot of supervisors are on the membership, and they can fit you in a lot of things. Do all your certificates, do your diplomas, try and ask that what else should I do, what else should I apply for. This is how you can go. Yes, you want to say something? If Iftikhar wants to say something. Usman, yes please. Oh, the ST8 is considered a consultant in my books. For all young people, I would say go for training. For people like me who are very old, who graduated years ago, I'm doing myself Caesar, and I will do a Caesar meeting very soon, and I will bring somebody who's actually done Caesar and a consultant. Only about it's about your goals again. You set a goal and you achieve it if you work towards it, right, Usman? Do you agree? No. It's just a title. It's not not a race. That's the point. It's not a race. Enjoy what you're doing. Yeah, I was also discussing. I was also thinking that. But a lot of people are from UK actually from on this platform at the moment. So that is
We
good.
were expecting that as well. Just mentioning, we had 400 plus registrations, so I'm not sure. I think, to me, we think it's probably the Saturday factor and the timings. But yeah, we'll keep on doing these sessions regularly, and hopefully we'll get more people along and get sessions. But not bad, so thanks for anyone who's come in. We do appreciate guys, and it's not a very small number. We've got supervisor now. I think she can add her bits onto it because I know that she has been doing procedures and assisting in sternotomies.
Here, if you are working, they acknowledge it more as compared to back home. You work almost the same amount or even more back home, but you are not acknowledged that much. So that's one thing. But apart from that, I can speak a lot more on surgery, but I think we need a separate session for the surgery. So if we have people here interested in pursuing a surgical career, I would be very happy to organize another webinar. We will involve the senior surgical registrars and other relevant people, and we can organize a webinar on that, inshallah, if you are interested.
We've got a hand raised from Mr. Haj. Nadia, need to add on? No? Any questions, guys? Anything you guys want to say? Any particular questions? We've got A&E registrar with us as a speaker. We've got people working in surgery. And myself, I'm a medicine trainee first year, so can't promise you, but hopefully if there's anything that you've got in your mind, anything that you were looking forward to, or you are planning to apply in next year, or even in this round, it's not even relevant to this session. If there are any questions, guys, do ask us. If you have.
Yeah. Just out of interest, is there anyone in the list who is interested in pursuing core surgical training here, like from CST or ST1 level? Is there anyone? Please like and recommend.
Saf did say that he wants to have a surgical session.
Right, perfect. We'll definitely arrange one because I applied for core surgical training this year as well. I'm just waiting for the outcome by the end of this month, inshallah. So we can definitely talk about this and arrange something.
To what Iftikhar said, I'm going to add is when you come to this country, don't think that you have to set your goals straight away. I know a lot of people who came, wanted to do surgery, who wanted to do A&E, who wanted to do a lot of different things, but they ended up doing very different things. So don't think, but I would give my example. For example, when I started doing my med school, even before my med school, when I was in high school, I wanted to be a neurosurgeon. Okay, I did my med school, did distinction in surgery because I wanted to be a surgeon. I did my my foundation or house job or whatever you want to say it, and I joined surgery. And I worked surgery in my country among surgeons. I left surgery and went on doing something very different. And I wanted to become an emergency physician, and I am now working towards it. So the thing is, where you started, where you headed, it doesn't matter until you enjoy your journey. I enjoyed my journey, and I am still enjoying it, and I think that's what matters. I've got 4 kids, and they're enjoying their time, and I spend time with them, and everything is like it all comes down to what you want to be as a person. Do you want to enjoy your life, or you want to get a title? What's your goal? So it comes down to that. And I know a lot of people. I know one of my colleagues who actually completed surgical training in Pakistan and is now working as a GP in UK. So it depends what you want to do with your life ahead. It will change with every year, with every circumstance change in your life. Do give importance to important things like your family, like your health, like yourself. Your physical, mental well-being is really important, and I think it is really not given importance, even in this country. It's not given high importance to the mental well-being of doctors and medical professionals, while it should be really important. People who work for everybody should be, taken care of well. So think what you want with your life. Some people want to live a day every day, like Usman said, and they will be fine. They work trust-grade jobs and they become registrars, and they sometimes become locum consultants even, but they're happy with it. They don't want titles, they don't do exams. I know a lot of people in my department who didn't do exams and they are happy with their life. They're earning well, their families are well, they like the rota system, and they go home happy. So at the end of the day, it depends what you want to do. And in this country, I felt that there's so many choices. As a medical professional, you get so many things that you can do, which unfortunately are still lacking in our countries back home in Pakistan, India, and in Middle East even. I don't know if but a few people of you have worked in Saudi Arabia or Dubai. You can actually work as a trust grade there as well and enjoy your life. So be when I say set your goals, it doesn't mean that set your goals in terms of titles that you want to be a consultant, this. Set your goals in terms of where you want to see yourself in next 5 years, and be clear about it and work towards it. If that makes sense. Any more questions? Is there a question?
The concluding use, can you clarify?
What? Okay, let me clear myself. I'm Amber. I'm not Bisma, and I've got 4 kids. My eldest is 8, and when she was born, she was 1 year old, and I decided I don't want to do surgery anymore because I couldn't give her time, and because, like I said, I was at the pinnacle of my surgical training, and if I did a surgery, I had to go back and see my patients again, and I hated it. The thing that I hated in surgery was there was so much baggage. In A&E, there's no baggage. You go home, you go home. So yes, I am Amber with an A. Any more questions?
I think it was more of quality than quantity here. So we've got no regrets there.
Agreed.
Somebody waiting in the lobby.
I admit it. I think we are already finishing.
So yes, Fatma was, thanks for your comment, he was saying lovely seeing all the other trust road doctors. So Fatma, we've all been, every one of us has started from the same grade, and I think that's what Britic is about. Just join us, we're all together. We've all started from the same space, even if not, even if the journey is somehow the same for everyone. So even if it's different, you can always learn something from someone's journey, even bits and pieces. Like I mentioned, even now, we've been working in NHS for some time. We always learn new. We've learned a lot of new things from this session today. So, yeah, thank you everyone. As I said, it was more of a quality which matters today. So it's not about the number of people. It's, I think everyone's been so involved. And even if one person just learns one thing, even for ourselves, if we learn one thing, that would be, that just does the job for us. Any more questions, guys? Any more suggestions? Those people who have joined a bit late today, if there's anything you guys want to ask, please ask. We're still here before we wrap up the session. Thank you for your compliments. Anything, guys? Anyone who wants to say anything? Is there something you might be just thinking of wrapping up the session very soon?
We will also send a feedback for everybody. Yeah, a feedback form. Sorry, Bisma.
Sorry.
Yeah, we will need to send you guys a feedback because that will add to our portfolio as well. So everything adds on. So if you guys would be kind enough to fill in those feedback forms, thank you again. And any more questions, please?
So we're just thinking of if there's nothing, you might just be wrapping up the sessions. Just on a bit of, that if you guys can just follow us on social media, even after the session, if you've got any suggestions, or if you guys are interested to present anything, want to do a similar session. So feel free if you want to present something, if you want to do something for your juniors or seniors, or maybe just you want to have a get together, or if you're just in this country by yourself and you're looking for some friends, some trainees, or anyone, not even from the same country, we're all here. Anywhere you want to meet up, a quick catch up over a coffee session, this platform is for you all. So as Mona said, let's climb the ladder together. So you guys do feel free, just drop in a message, leave your message away. It could be anything, and we'll be more than happy to help you guys. And if there's nothing in the next few minutes, we might be ending. Oh yes, we do need a Manchester get together. And we've got someone, if the heart is living in London, so it could be anywhere, guys. So let us know where you guys are from. Yeah, so it could be anything across the country. Yep.